Hi, this is Unit 2 Part 2 of Pathophysiology practice questions. Let's go. Which of the following is a common clinical manifestation of systemic lupus erythematosus, SLE? A. Arthritis. B. Weight gain. C. Decreased appetite. D. Increased energy. 5 seconds. Correct answer. A. Arthritis. Arthritis, joint pain and inflammation, is a common symptom of systemic lupus erythematosus, SLE. A patient is admitted with shortness of breath, wheezing, and facial swelling shortly after being administered an intravenous antibiotic. Which type of hypersensitivity reaction is most likely occurring? A. Type 1. B. Type 2. C. Type 3. D. Type 4. 5 seconds. Correct answer. A. Type 1. The acute onset of shortness of breath, wheezing, and facial swelling after exposure to an antibiotic suggests a type 1 hypersensitivity reaction, such as anaphylaxis. A boy is stung by a bee and develops itching, swelling, redness, and difficulty breathing. Which immune response is likely at play here? A. Ig. M-mediated response. B. Ig. A-mediated response. C. Ig. E-mediated response. D. Ig. G-mediated response. 5 seconds. Correct answer. C. IgE-mediated response. The symptoms described as itching, swelling, redness, and difficulty breathing are typical of an allergic reaction, which is most commonly mediated by IgE antibodies. When a person is exposed to an allergen, like bee venom, their immune system may overreact, producing IgE antibodies. What distinguishes a secondary immune response from a primary one? A. Ig is the predominant antibody. B. It leads to immune system sensitization. C. It involves a longer latent period. D. There's a rapid increase in antibody production. 5 seconds. Correct answer. D. There's a rapid increase in antibody production. A secondary immune response occurs when the immune system encounters the same pathogen after the first exposure, primary response. During this second exposure, memory B cells, which were formed during the primary response, recognize the pathogen much more quickly, leading to a faster and more robust production of antibodies. How does cortisol help the body during the stress response? A. It inhibits the initial inflammatory response. B. It boosts early inflammation. C. It stimulates Th cells to boost innate immunity. D. It dampens adaptive immune responses. Correct answer. A. It inhibits the initial inflammatory response. During stress, the body releases cortisol, a hormone produced by the adrenal glands. One of its key roles is to modulate inflammation. Cortisol helps by suppressing the initial inflammatory response through its action on immune cells and cytokine production. Thank you for reviewing with me. Don't forget to subscribe to PN Practice Questions for more content. Up next, Unit 2, Part 3 of Pathophysiology Practice Questions.